Hello and welcome to Bottom Line. Well, COVID numbers continue to surge in northeast states. Assam, Meghalaya both saw surge in numbers today. Assam crossed the 900 figure mark and is racing towards the 1,000 mark very quickly. Meghalaya saw 6 more positive cases. We will discuss all this with our panelists. Meghalaya Deputy Chief Minister Preston Tinsong will join us in a short while, but we will start with the big story this evening. The first international flight as part of the Vande Bharat mission landed at the Lokopriya Gopinath Bordoloi Airport in Guwahati this evening. The flight carrying around 155 stranded Indians arrived from Kuwait as part of the Vande Bharat mission. Among those who arrived are 98 from Assam and 52 from Tripura. The Jazeera Airways flight made landing at the LGBI airport at sharp at 5:35 p.m. and all necessary facilities were extended to the passengers. So repatriation flights have started to arrive. The first international flight during lockdown today landed at the Guwahati Airport. All passengers from Assam were taken to Hotel Kiranshi Grand for a collection of swabs, following which they were being sent to the respective quarantine centers. Airports, of course, functioning for the last 4 days. Before I go to my guest, I am being joined over the phone by Mr. Sanjeev Jindal, the Regional Executive Director of Airport Authority of India, over the phone. Thank you, Mr. Jindal. Welcome to Bottom Line. So it's been 4 days since airports became functional. Any specific challenges you are facing, or it's been a smooth run so far, Mr. Jindal?
No, actually it is the first time this kind of thing is happening in the history. So every day is a new challenge and new surprises for us. But because we got the sufficient time and we were preparing from last more than 1 month, like how we will use the technology and the best possible options, equipment, partitioning, systems, PP, so that we are able to have minimum touch or almost touch-free operations. And we were continuously cleaning it, sanitizing it. We were procuring the chemicals. We were studying the chemicals. We were studying the gadgets, thermal scanning gadgets, and whatever, the IT solutions. And regularly we were on our job, not only in our Northeast region, but Ministry of Civil Aviation, Airports Authority of India, at pan-India level, and with the international advisor also, we were doing so many video conferencing, and so we could prepare all well-defined standard operating procedures, and these are being used for all the airports, our airports and other private airports, PPP airports, all airports pan-India. We are using the best possible options, and so that we operate in a safest way. And I must tell that we are doing one of the best procedures in not only in India but in the world. Yeah.
Absolutely. And was there a comprehensive training for all the airport staff in the run-up to May 25th? Because this is not an easy task. Moreover, airport staff are again not doctors or health professionals. They are also civilians who are now doing the job of frontline workers. So was there a comprehensive training carried out before?
Yeah, absolutely. You're right that because we got the time, and during lockdown period, our airports were operational. So we were handling cargo flights, and especially the Life Udan, where we transported more than 220 tons of PP material. But side by side, to handle the passengers, we were training our people with using the video conferencing, using different experts, even NDRF, they have expert and expertise, and they also conducted training at all our airports and with all stakeholders. And the experts were involved, and each and every person and stakeholder in airport were trained. Yeah.
Absolutely. And of course, today we had the international flight arriving from Kuwait with 155 people on board. How was it different for the staffers handling an international flight than a domestic one? Mentally, I'm sure the protocols remain all the same. But was it a different feeling? Was it a different challenge that it may have felt like?
Actually, protocol is the same as you have rightly pointed out, but there is a difference. 100% we are testing each and every person, and moreover added custom and immigration other formalities that is applicable to all international flights. And so custom and immigration counters were also segregated. The whole international areas were given social distancing as well as non minimum touch, all kind of hardware infrastructure like screens were provided so that there is no actual contact with the passengers with anybody else. So both should be safe, the operating people as well as the passenger. Nobody should be able to become a risk for each other. Now, as far as international flight is concerned, it was almost same. Psychologically, yes, because a little bit more conscious. Everybody was more conscious and more rigorous, and we were very our efficient doctors and paramedical teams. They are working day and night, and they were very, very keen and taking little bit more time that not even a single symptomatic case is missed, and only a symptomatic case which we can find out only after the test, that is left out. So yes, this was a challenge for us.
And initially when the operation started on May 25th and during the training period also, we have had cases in the past where everybody has been skeptic, the general people and everyone skeptic of this coronavirus thing. So did you find any reluctance among the staffers in the initial times, reluctance to join, because it's only natural because the fear of the virus is very much there.
You are absolutely right. You clearly want to say that the risk is more if we allow more passengers, airlines passengers to come inside and move here and there. The corona spreading risk is more. There is no doubt about it. The risk is more. But I will tell you, there is an interesting fact. It is not risk is more. Rather, we are reducing the risk. How? See, airport premises and air travel is like that. Not even a single person without identity can board the aircraft. We have the complete identity, and we have only one entry and thoroughly checked entry. So all the passengers, all the person who are moving, they need to be screened and tested again and again. Now, because 100% arriving passengers are being tested, so it's a kind of combing,
Absolutely.
Symptomatic is fine. Symptomatic also we are screening so many passengers who are symptomatic in nature. But at the same time, because we are doing tests also, in fact, state governments are doing very good job. They are testing them and they are taking into the quarantine. So otherwise the asymptomatic person, a patient who was otherwise also traveling, staying somewhere, may not be in Guwahati, Northeast, might be in Delhi or might be somewhere, who was not even aware. Now he is also aware. He is also authority or everybody now knows about that he is a corona patient and he can be treated. So it's a kind of combing and betterment.
Absolutely.
Like combing, and we are reducing the possibility of spreading of corona.
Yeah. Absolutely. Thank you so much, Mr. Jindal, for all those updates and your perspective on that. Thank you so much. That was Sanjeev Jindal, the Regional Executive Director of the Airports Authority of India, the Northeast head of the AAI. I'm being joined now from Shillong by Meghalaya Deputy Chief Minister, Mr. Preston Tinsong. Sir, welcome to Bottom Line again. 6 new positive cases we have had today. But again, my first question is, there are less than 2,500 quarantine seats in Meghalaya. The number of those coming in is much larger than that. You still may have 5,000 to 6,000 coming in. Of course, they are not coming in all at once, but still there will be a constant pressure on quarantine centers since you have decided to keep people in at least 3 days facility quarantine. So how is the government looking to handle the situation? Are you looking to increase the quarantine seats?
As far as the institutional quarantine is concerned right now, I think right now it is enough for us to to take care of those stranded friends, stranded students coming in from different parts of India. Because as I said to you, it takes them maybe maximum 2 to 3 days to get the report. The moment we get the report, those who are totally negative, then we send them back to the local quarantine centers, or maybe to their home quarantine. So right now our calculation is still okay. We don't have much problem. And for your information, I would like to tell you also that till today, our friends coming in from different parts of India, we have already we are about to reach 11,000, and the remaining would be maybe not more than 6,000.
So 6,000, you are saying 6,000 more, 6,000?
6,000 more, and then 11,000, almost 11,000, they already reached back to Meghalaya.
Okay, and as far as testing rate is concerned, is the state comfortably placed? Of course, NEGRIMS has been continuously raising the testing rates.
Well, right now, these testing facilities also, we have enough numbers because the capacity per day is about 400. Testing, we can do it in a day. So when we calculate on daily basis, I think that can take care of everything.
And any input on by when the last batch of returnees will arrive? That will at least give us a clear idea as to when we can expect things to come under control. Any idea when the last batch will return by the Shramik trains or by the flights?
Of course, right now, in fact, who are on the way, in fact, the special train from Delhi, then from Kerala, they are on the way, they are about to reach, even from Goa, they are about to reach. So most likely, as I said to you, maybe by 31st of this month, we'll be able to bring those people whom we already organized the special train. But of course, now we are waiting for Mumbai as well as Pune, where the special train is not yet finalized. But I'm sure within 2-3 days' time, we will be able to finalize that.
And how many people are lodged in the quarantine centers right now? Would you have the exact figure, sir?
Well, the detail I don't have because, as I said to you, average we are taking is maybe around 250 to 300 people. They come into to the state. So those people, we sending them to the respective, as I said to you, to the respective institutional quarantine center. Then they have to wait there till the report of RT-PCR is received. Then that's what I'm telling you right now. In fact, as far as institutional quarantine places is concerned, the capacity is still okay. And then I'm sure even within next week, we'll be able to complete the entire bunch of our friends coming in from different parts of India.
And my last question to you, sir. Today, Kindailat or Police Bazaar opened partially. When can we see the next wave of relaxations in the state?
Well, yes, let us see. I can't say right now, but of course, review meeting will be held regularly, so we will take a call on that.
All right, thank you. Thank you so much, Mr. Preston Tinsong, for all those updates. That was Meghalaya Chief Minister Preston Tinsong joining us from Shillong. Shifting focus now, the Himalayan state of Sikkim. The Himalayan state of Sikkim is facing a new challenge. It has not yet been able to put in place a functional testing lab. It was testing all the samples all the while in the neighboring North Bengal hospital that is just across the border in West Bengal. But due to increasing number of cases and increasing number of people coming in Bengal itself, the North Bengal hospital has said at least for the next few days it would not be able to test any samples from Shillong because the samples from within West Bengal have piled up and there is no way that it can take the burden from any of the neighboring states. Adding to the problem is that the testing lab that was inaugurated a few days back at the STNM hospital in Gangtok is yet to be made functional. It may be made functional in a day or two. That is what the State Health Secretary told Northeast Live today. But as of now, the state is awaiting results for 800 samples. 85 samples were returned from the North Bengal hospital yesterday. So what is the way forward for Sikkim? Because returnees are coming back in hundreds every day. This will put a burden on the facility quarantine centers. Samples need to be tested. Those who test negative will have to be sent to home quarantine. But in the absence of any testing, the numbers will only increase. We are being joined by Dr. Beena Basnet, President Hamro Sikkim, to discuss more on this. Mr. Navraj Gurung, SKM General Secretary, will also join us in a while. But Dr. Basnet, Sikkim, which had managed to stay COVID-free for a long time, and of course you can't deny any credit to the state government for this and the people of the state, but the state is facing a crisis of sorts now as returnees reach state. Lack of testing center, a functional testing center is the crisis Sikkim is staring at now. Do you think the Sikkim government, how could the Sikkim government not see it coming, Dr. Basnet?
So I think Sikkim, basically the health infrastructure since the beginning only, we also belong to a political party and we had come to politics also just because of all these things which were lacking behind in the state. And the infrastructure was so bad that every patient from Sikkim, like whosoever were serious, they were taken to a district. Siliguri is a district of West Bengal, but being a state, we are referring our patients to Siliguri. It's quite sad for the state. So we were quite vocal about it. So hurriedly, a big hospital was inaugurated and things like that by the past government. But what happened was the infrastructure was lacking, though the structure was ready, but the infrastructure was lagging. So for now, because there was no virology lab in Sikkim, the RT-PCR was just done in Manipal, and there also it was not quite functional. So for them to set up a virology lab itself takes its time because it has to get accreditation from ICMR and things like that. So recently they have come up with a lab and all the process of accreditation and all of those things took them time because biosafety and everything has to be set, the technical aspects of it. So most probably they're saying, according to their statement, they're saying that in a day or two they'll be able to do it. But now we can't also really blame North Bengal government or North Bengal College for not taking the samples because they are overburdened right now because they're getting samples from so many districts. For them, it is the samples are overwhelmingly coming, and then for them to handle samples from other states is also difficult. So we can't also blame or burden them with that. So for us, the real requirement was that we should have been prepared in a sense that we should have had the lab before, but it was lagging. We can't blame the present government also because they're trying, but since the structure, since everything was lagging to even get all the technical aspects into place, so it takes time. So it's quite sad and unfortunate now the samples are coming back, and hopefully we're just hoping that like in a day or two our lab becomes functional, because the only test which they are doing now is through NAT, and that is not confirmatory. So with RT-PCR functioning, I hope in day or two that our lab becomes functional. So yeah, that's the scenario here.
Now, yes, but now there is no certainty whether the testing lab at STNM will be functional by tomorrow and the samples will only pile up. What should be the immediate action plan if, say, the lab, God forbid, doesn't become functional in a few days' time? Would Sikkim require to restrict entry of the stranded for a while?
So I think the standard people, because since the population of Sikkim is not that much, and then the people coming in are not in huge numbers. So the quarantine centers, because it's been set in all the districts, so it shouldn't be overwhelming the quarantine centers. Here, what I think is like, what they can do is like, since the TrueNat they are doing it, so at least the negative test is confirmed. That the test, if they are negative, then people who test negative are sent for home quarantine after 7 days. So they're taking samples like in the fifth, sixth day, and then they are, if the test turns out to be negative, they're sending the samples home. If at all any test is coming positive, then they were sending it to North Bengal for confirmatory. So for now, what they can do is like half of the samples were going to North Bengal. Now what they can do is like whatever test can be done through TrueNat here will be done, and they can send like whosoever test negative can send home, and then it will be a slower, the process would slow down, of course. But yes, if there is at all any positive test, then they should make a special request to the North Bengal to like really confirm the case. If at all the state
Absolutely.
doesn't function, the lab doesn't
Absolutely.
function in day or two here.
That will be required. Beena Basnet, just digressing a bit, do you think the state government has, the Sikkim government has an economic revival plan in place in a state which is majorly dependent on tourism?
So I think since this is an unprecedented crisis for all the states, it's quite difficult for the state. According to our CM statement, they're saying that their task force is ready, and they have taken people from every strata, and from all the they've taken all the stakeholders, and they are really working on the economic revival plan. But to bring it on ground, it's quite difficult, because Sikkim as such also, it's dependent, mostly the revenue, it comes from tourism. And now because of this pandemic, and we were hoping that Sikkim was not detecting any positive case, so we thought that later when there is the opening of the lockdown, people would come to a safer zone. So we were hoping that the tourism would pick up like once the lockdown was over, and we could really focus on how to take it in a new hygienic and different ways of like taking the tourism forward. But now since now the cases are being detected here also, like, so there is a big question mark on how tourism is going to pick up. So let's see. I mean, government, they're saying that they are really working on it, but of course, like, it's quite difficult to say for now. So we're just hoping everything falls on place, and then yeah, the poorer sector, we are being vocal about giving up direct benefits to the lower income strata group, like drivers and migrants and people like that, so they can get directly benefited. And also all these small businesses which are here, to giving them loan, and whichever is viable to support them to really recover. So they have come up with few plans, but still to get things on place and get it implemented, it's again a big question mark. Let's hope for the best.
Absolutely, let's hope for the best. Thank you so much, Dr. Beena Basnet, for joining us. Well, we are trying to connect with the SCAM General Secretary Navraj Gurung. In the meantime, we have our in the meantime we have our Gangtok correspondent Sujal Pradhan over the phone. Sujal, what are you picking up from your sources? Is there any possibility of the testing lab at STNM being functional by tomorrow? Sujal.
Yes, as I talked with the General Secretary of Director General of Health Department, he confidently said that tomorrow a team from the Kolkata, in fact, they are already reached the Bangalore, so tomorrow they will test they are bringing their own test sample, which they will try in the Sikkim, as per the norm. As per the norm they are doing. So if the test went all went, then the test from Sikkim can be done from tomorrow.
And how many are more samples piling up, Sujal? How many samples are waiting results in the North Bengal hospital now? Of course, we know 85 were returned yesterday, but already how many are piled up there?
Yes, in fact, they are seeing that in 6,194 samples were pending. There are nearly 800 are from Sikkim are pending from Sikkim side.
All right, Sujal, thank you so much for all those updates. We will have to take a very short break here. After the break, we'll be joined by SKM leader Navraj Gurung. We'll get to know the government's perspective, the Sikkim government's perspective in all this. Welcome back. You're watching Bottom Line. We were discussing the situation in Sikkim. Samples are piling up in Sikkim as there is no functional testing lab. We'll also be joined from Shillong in the meantime by Dr. Prasenjit Biswas, Professor Nehu. But before that, we are being joined over the phone by Mr. Navraj Gurung. Navraj Gurung, of course, is the General Secretary of the SKM and also the party's social media in charge. Welcome to Bottom Line, Mr. Navraj Gurung. The lone testing lab in Sikkim is yet to be made functional. In the meantime, samples are piling up. So what is the plan now? Can we see the testing lab being functional in the next 2 days?
Yes. Sir, today some equipment has arrived today to SKNL, and most probably the test will start from tomorrow. And if not tomorrow, then day after, definitely from day after, the RT-PCR test will be carried on in SKNL itself. Yes, and some of the samples are still pending in the North Bengal Hospital. I don't know. I'm not supposed to comment on it, but this is till 4 days. Till the next 4 days, they have said new samples will be taken. So we have around 800 samples still pending. But from tomorrow, or at the least day after tomorrow, we will have our own RT-PCR lab running. So we won't need to go to North Bengal.
Well, there is great news if it becomes functional by day after tomorrow. But do you think, Mr. Navraj Gurung, this could have been avoided? I know there are a lot of systems, procedures, protocols that have to be followed. You need permission from the ICMR. There's a lot of procedure that goes into it. But do you think this kind of a situation could have been avoided if things were done in a war footing, which I'm sure it was, but maybe if things were speeded up a bit more?
For this government, it was a new thing. And as you know, a virology lab was proposed by the Indian government during the time of Mr. Pawan Kumar Chandling, but he was some fund that also decided, but he did not give any place for starting the lab, and that is why we did not have a virology lab in Sikkim till today. But immediately after the COVID thing came up, although the lockdown was there all over the country, but we still managed to get the equipment, and by now the room, everything has been ready, the equipment has been put in place, and now some little technical errors are there, and from tomorrow or day after tomorrow, they are going to run the lab. So that is not much of a problem now.
Okay, absolutely. And with the number of stranded coming back to the state, any plans in the long run, especially some of them may not go back very soon, the conditions are not feasible. Is the government, what is the government's economic revival plan as far as Sikkim is concerned?
In regard to economic revival plans, we have a committee formed led by a BJP MLA, Sonam Benjampa, and Mr. C.N. Benjampa, the Chief Economic Advisor to the Chief Minister, is also a member there. Professor Mahendra P. Lama, another Chief Economic Advisor to Government of Sikkim, is also a member there. And one of our youth DCs, his name is Sonam Bompo. He is also a member there. I think he's a IIM graduate, so he's also a member there. And the member secretary is Finance Secretary come Additional Chief Secretary, Mr. V.V. Pathak. So now their meetings are going on. They are deliberating on every issue, and soon we'll come up with a report. So this way we are for economic revival. And this committee has been very good people have been put in this committee, which shows the state is very much serious in the revival of the economy here.
My last question to you, Mr. Gurung. Sikkim is a state which is majorly dependent on tourism. How difficult do you think is economic revival in such circumstances because of the current situation, because of the current pandemic?
Well, we know that the effect is going to be large. Okay, it's going to hit us quite well. But we are prepared for that now. There's nothing we can do right now. If the lockdown continues and if we are not supposed to allow our tourists to get in, then yes, some economic problem will come up. But the state government is there, and the people will also cooperate. Hoteliers, they are holding the meetings with the state government, and everyone is in touch with each other. So we are there. We are aware that now we will not have any more tourists, and since this being a tourism dependent state, yes, it will have a big effect in our economy. But the state government, with collaboration with the center and from the help from the center, we will manage it. We will manage it. We are looking at how we can compensate the hoteliers or this kind of businesses. They have also placed their demands to the government. Nothing has been finalized now, but yes, the revival committee will come up with a report, and in that report, it will advise the state government for the steps to be taken by the state government. And that way, we are quite confident we can handle it.
All right, Mr. Navraj Gurung, thank you so much for all those updates. We hope that the testing lab becomes functional in a day or two. Otherwise, things look a bit critical for the Himalayan state of Sikkim, which of course has done very, very well so far as containing the crisis is concerned. Well, I'm being joined live from Shillong at this moment by Dr. Prasenjit Biswas, Professor Nehu. Dr. Biswas, welcome to Bottom Line. Dr. Biswas, as in Shillong too, commercial establishments are now beginning to open. We had shops opening in Police Bazaar, Kindailat today. We are getting back to normal life again, but do you think as we try to head back to normal, probably testing and capacity building are the only way out?
Yes, testing and capacity building in terms of continuing with finding out the symptomatic cases in particular is the most important thing, because asymptomatic cases cannot really be handled if they are in large numbers. So I believe that there is no community transmission as yet, even in Mumbai. Therefore, one can go ahead in a cautious way by maintaining the norms of masking and safe distancing in public places without making huge crowds here and there. It would be possible to really identify the probable cases of diseased people, and then the medical redemption and medical curing could be immediately processed as well. Yeah.
Absolutely. We are being joined over the phone by our Itanagar correspondent Indu Chukwu at the moment. Indu, Chief Minister Pema Khandu has held another review meeting today. Give us the details of the meet, Indu.
Yes, Nabarun, there was a series of cabinet discussions meeting today, since this morning from 10:30. So, important points of the meeting are the cabinet has approved for the upgradation of the 18 district hospitals in the state, Nabarun, and along with the new hospitals for the newly created districts in an estimated cost of rupees 365 crores. With a time period for 24 months, that is 2 years. And also the cabinet has also approved for the development of 2,000 kitchen gardens as per the assembly constituency, in order to have self-sufficiency in the state for in the basis of nutritional needs. And also the cabinet has also decided on the developmental of agriculture farm cluster per assembly constituency. So, these are the major things that has been taken up in today's cabinet decision. And considering the need for procurement of several equipments for the medical facility for the COVID-19 especially, so various, especially the PPE kits and the VTM procurement, they have decided to procure, and also the 10 Qtro of and 4 Dio TrueNet machines. And as per the report, we have also got to know that in districts like Pasighat and West Kameng, there will be also the procurement of these TrueNet machines. But currently, it is here in the state capital. And also, it was also further decided to equip critical entry gates with the testing, especially for the drivers and essential items. And yes, Nabarun, various various important issues have also been discussed further regarding the plan and policy under various departments, Nabarun.
And Indu, since I have you online, can you just brief us an update on the flood situation in the state? Is it any better now? What are the measures being taken?
Regarding the flood, the disaster management department has already been on the ground, and as per the reports by the IMD recently, the state will receive heavy rainfall, and it did receive, and considering it, even the state disaster management rescue response force along with the NDRF has also been on the line, and they have also been into several few districts like the Dibang Valley and the West Coming from NDRF. So it is under control, and for the past 2 days from yesterday, the weather is quite normal now, and even according to the state disaster management, they are under control, and as of now, the state is under green zone. They are undergoing various precautionary measures on this.
All right.
Issue, yeah.
All right. Thank you so much, Indu Chukwu, for all those updates. Dr. Biswas, coming back to the COVID crisis, there's a lot of talk again going about the so-called lockdown 5.0. Should it be called lockdown at all? Because we are certain that more relaxations would be coming in. So calling it a lockdown per se creates a mental block in a way that the country also needs to get along and go back to its economic activities with a much greater force probably than what it is doing now. So what do you predict?
No, it should be a kind of a proper and adequate public health measure instead of calling it a lockdown, because the idea of lockdown and curfew haven't really gone down pretty well with the large section of people, especially with migrant workers and the large section of people who depend on wage earning. Hunger is building up in various parts of the country, and we have seen what kind of immense suffering the migrant workers and migrant communities have been facing. Therefore, lockdown as a concept, I don't think should be experimented with too much. It has been already experimented with, and the results of its impact on the public health is already seen. A lot of patients are suffering because of stroke, because of psychological issues, and so many other kinds of symptoms that have arisen because of self-isolation and lockdown, and because of lack of access to income and employment. Therefore, it should be called as a kind of a measure for preventing any possible transmission by using people to follow certain norms in public places. Norms like putting mask, sanitization of the public place, using cleaning one's hand every time, and also maintaining safe distance could be some of these norms that could be followed in the public place. But economy, society, education, various aspects of life need to bounce back, and people have to cope with the idea of living with the virus. One cannot always perpetually live in a condition of lockdown. So therefore, we have exhausted probably the means of lockdown.
We will come to that point of education, but I'm being joined over the phone now from Aizawl by Isaac Zoramsanga, our Aizawl correspondent. Isaac, how many stranded people have returned to the state today? What is the numbers?
Yes, today in the morning there are 1,345 stranded from Bangalore arrived here in Bhairapi railway station. Now, after that, they headed back to their respective quarantine centers in the state. And after that, from Madhya Pradesh and Gujarat, overall around 600 have reached at Bhairapi railway train station. So overall today there are around 2,000 people have reached here.
2,000. 2,000 people. Isaac, currently what is the intake capacity of the quarantine centers in Mizoram roughly?
Yes, currently there are the intake capacity. We don't have like the exact figure yet, but as of now, we have heard that there are more than 3,000 people are in the quarantine facility center. So they have been distributed to each of the government quarantine.
Is this 3,000 including the 2,000 who came today, or that will be additional?
That will be additional.
Additional.
Because those 3,000, those 3,000 were like the earlier calculations. So after this, adding to these 2,000 who came, who arrived here today, so they will be 5,000. So yes,
so how many in total? How many in total can Mizoram at this point in time afford to keep in facility quarantine? How many people in total?
Yes, according to the officials, they have been, they say that this government quarantine center would not be fit for all of them, and they say that only around 10,000 people would fit for the government quarantine facility center, so that they urge the church body to use their church hall for quarantine centers, and even also urge district authorities, like local level authorities, even local council leaders, to make simple quarantine centers for each of their localities.
The government is already pushing for community quarantine centers also.
Yes, community quarantine center, that's right.
Okay. And Isaac, how many more people are expected to return to Mizoram in the, say, next 1 week? Any updates, any figures on that?
Yeah, tonight around 400 stranded migrants from Goa have departed from Goa train station. So as of now, we still don't know when they will reach, because of the weather problems and some natural calamities like landslides and even some weather problems happening. So, but as of now, these Goa people are still on their way, and even also Delhi are set to depart from Delhi train station tonight.
All right, Isaac, thank you so much for all those updates. So a lot of almost everybody is coming in, is being put into facility quarantine in Mizoram. 10,000, roughly 10,000 is the intake capacity. Around 5,000 people are already lodged in the facility quarantine centers. Dr. Biswas, coming to the issue of education, of course, various state governments are also now considering how to resume the classes or at least conduct the exams that are remaining. But in the long run, we cannot probably defer things beyond say July or August. Can we afford to do that?
See, the UGC circular that has come today talks about the health issues of the students. Once a university or an institution is sure about maintaining the health issues and maintaining certain standard security and safety measures for the students, it will be possible to run the institution. That's a kind of a hint that arises from the UGC circular today. So therefore, like in China, the schools have reopened, even in Wuhan province, by maintaining certain safety norms and measures. In England also, in a staggered manner, schools are going to be open until September. Of course, there is a different kind of a seasonal variation there. But in case of India, maybe in next 1 month, the educational institutions must start again functioning, and that way we can save the precious academic year and the academic future of a large number of students, given that we are a hugely populous country. Online teaching is not going down well because only 5% of the total population have access to computer or any kind of smartphone. So students are really deprived of the right kind of gadgets. Unless right kind of gadgets are provided, even then online education remains self-directed, unassisted kind of education that will not really
but do you think,
augment the capacity of the student.
Do you think, Dr. Biswas, do you think in a country like India, online education is even possible at this moment? We run the risk of leaving out close to 80 to 90% of the pupils. Don't you think so, even now, despite all the claims about digital India and whatnot?
Yeah, digital divide is too strong. Digital ways of teaching actually perpetuate the existing inequality in a much sharper manner. Students who are rich and who have comparatively better access to the internet facility can only gather material. But process of learning is always teacher assisted, even at the highest level of education, even at the level of the research. Therefore, online education is no substitute for contact-based, face-to-face education, because students need inspiration from the teacher to learn something, especially at the level of higher learning. Therefore, online education is not really the way out. It can be a temporary way of covering up a certain kind of a gap or maintaining the connection between students and teachers, but it cannot be anything beyond that. One has to remember it.
Absolutely. We are being joined over the phone from Shillong now by Dr. Sinrang Warjri of Nazareth Hospital. Welcome, Dr. Warjri, to Bottom Line. Well, we had the Meghalaya Deputy Chief Minister, Mr. Preston Tinsong, in the show a while back. We have less than 2,500 quarantine seats in the quarantine centers across Meghalaya. Around 6,000 more people are expected to come in. Dr. Warjri, do you think with the number of cases increasing almost every second day, probably a thought can be given to increase the seats in the quarantine centers if need be? We should be prepared.
Yeah, of course, we don't have enough seats. There are so many people coming in. I have so many calls coming from outside, asking me about, should we come, should we not come? And there's so many of them are still planning to come. And it's that time of the year also where, everybody wants to come back home. Nothing is happening out there and work has not started. Everything is on a standstill. So they want to come back home, and many more us want to come back home. We need to increase. Definitely, we need to increase. As much as we can, we need to increase. I don't know how much we can, but then as much as we can, we need to.
And also, Dr. Warjri, well, we may have to live with the virus for months now, maybe a year and a half. Do you think slowly, first of all, for instance, Assam inaugurated the first of its dedicated COVID hospitals. Other states should follow suit. Besides that, probably even every private hospital may, in due course of time, also should consider having their own COVID units, COVID centers, because there is still no sign of the vaccine.
Yeah, so that's exactly what we need to do now, because what the lockdown has done is that it has reduced the strain on the health medical services. So what it did was had flattened out the cases, reduce the number of cases coming in bulk at one point of time, so we could handle them more easily. But now that the lockdown is out, there will be more cases coming in, and there will be so many people, and we don't want the health system to be overwhelmed by COVID cases. We want other patients who are suffering from other diseases to also get their medical attention. We don't want other people to die just because they're not getting the required medical attention because too much resource is being spent on COVID. So we need to separate. We need to get those people who are suspected COVID to other dedicated COVID centers with dedicated staff, rotational staffs with quarantine put in place, and then those who are not COVID, they should be separated. They should go on, with their own medical checkup, and the medical services should continue parallel on another, separate from each other. So that is very important. Meghalaya should start thinking in those times, because it is going to become more and more. It's going to increase more and more. And vaccine, as you said, it's not going to come. This year, it's not going to come.
My last question, my last question to you, Dr. Warjri. You are also right now serving in a private hospital. Are doctors in private hospitals also taking equal amount of measures when you are in the OPD? Because probably you have to treat every case with suspicion. At least that is the scenario in Assam, where numbers are rising at a rapid rate.
Of course. I mean, we're treating every case as a positive unless if it is any patient who comes in, we treat them as a positive. So we take full care. We wear our full PPE kits, and we try the best to minimize contact and stay out of any possible doubts, that you might contract or spread it. But then, how much can we do that? In the OPD, there's so many patients. People are starting to crowd. The people are starting to come in. The sense of normalcy is even starting to come back now. I look at the streets, people are walking on the streets, lockdown is slowly opening up, shops are opening up. Slowly, a sense of normalcy will come down, but then the virus is still there.
Absolutely.
So it's going to be very difficult.
Absolutely. Thank you so much, Dr. Vajri, for all those updates. Dr. Biswas, Dr. Prasenjit Biswas, last question to you. Since you have been somebody who has also been closely following all the research related to COVID, has the time come for us to realize that the virus perhaps is not as deadly as it is made out to be, and probably we should take care of the elderly and the children and move on with the activities? Should that be the approach going ahead?
The vulnerable groups with comorbidity is one very important segment who needed to be very strong care of. Other group is this younger people and aged people beyond 65 who are susceptible to this virus, also need to be taken good care of. So apart from these two segments, generally safety norms, use of quick medication, and also some kind of a medical surveillance, which is different from any other kind of surveillance, has to be brought into picture. A medical surveillance would entail that a certain person reports the symptoms immediately to the concerned authorities. If we can ensure a proper transmission of information to the right place and then subsequent quick action as it should follow after an information of ailment is received, if that kind of a transmission line and quick action could be organized, then it will be possible to really contain the virus. That is one part. The second part is the spatial understanding of in which area the virus is spreading. If we can understand the path of the spread of virus, which is very, very important, the viral path, that is another way of understanding by way of geospatial mapping and using virological insights into it. Thirdly, more importantly, the amount of viral load that a particular patient is having. If the viral load is 10%, if it is 15%, if it is not beyond 35%, then there is no possibility of a community transmission. So we have to use our knowledge of virology in a very specific manner to understand the extent, the depth, and the possibilities of this spread.
That, of course, will depend on the authorities, the decision makers, the respective health officials who are a part of making this decision. Thank you so much, Dr. Prasenjit Biswas, for all those updates. That's a wrap of Bottom Line.